went to the University of Illinois for med school, and I did grad school there as well. And then I moved to Boston for residency, and I'm in neurosurgery now, but I've certainly rotated on some other services. So I've looked and kind of worked on the general surgery service, and we did a plastics rotation. So even in residency, I think you get exposed to kind of different specialties still. And yeah, I'm happy to answer any questions you guys might have about med school or the application process or anything like that. Just with a grain of salt that like none of my advice is official. It's all like more or less my opinion, my experience, or the experience of friends. So, grain of salt, but.
Awesome. And then I'm Hannah. I'm the president of the Pre-Health Liaison, and I'm a senior here at Simmons. I'm on the pre-vet track. And then I know McKinley and Taylor are also on the e-board if they would like to introduce themselves.
Yeah, I can go. Hi, I'm Taylor. I'm the VP Pre-Health Liaison on the pre-vet track.
Hi, I'm McKinley. I'm the secretary of the liaison. I'm a biochem major, and I'm also on the pre-med track.
Cool.
So I can kick us off with a question. So one question that a lot of people had was, what advice do you have for a current undergraduate student trying to get into medical school?
Okay, that's kind of a broad question. It's a good one. I would say, definitely look at the resources that you have. So I think you guys have, if I understand correctly, like a pre-med like liaison or office, or I guess even, your organization. So I think there's always people around who have advised people before. So those are good people to kind of get to know early. And then, Mcat, all of that we know is important, study hard, get good grades. But I also think that having some sort of experience in the healthcare field is really valuable. So whether that's volunteering or shadowing, just more for you to really make sure that that's what you want to be doing. Because, we have a lot of kind of ideas of what we want to do, but just to make sure that that's what you really want to go for. And then I guess outside interests to, pursue those, whether that's, your hobbies or sports or religion, whatever it is for you, something that kind of, gets you going.
Kind of going off of that, we had a question sent in about what piece of advice that you were given that it's like the best piece of advice that you've had.
Oh, interesting. Let me think. So I was pretty undecided about whether to pursue med school or grad school, and I was lucky because my undergrad lab advisor kind of heard about this and pulled me aside and was like, you can do both. You can go to med school and you can do grad school if you really are interested in research. And that was kind of the best piece of information or advice that I've gotten. He said to me, you have a very scientific mind. I can see you do research, but if you want to go to medical school, that's an option. So I think, if you have kind of diverging interests or multiple interests, chances are there's kind of a way to either combine them or to, pursue one at one time and then switch. So I think talking to as many people as you can is probably the best thing to do.
Awesome. And then what types of experiences did you have before getting accepted to medical school?
Oh, in terms of like, what did I do with my life? Did I take time off or?
Yeah, or like clinical experiences as well, just to have some like patient care experience, stuff, anything really under that. Yeah.
Yeah, gotcha. Okay. So I shadowed a local pediatrician, maybe my second or third year in college. And just literally, I think randomly emailed her and was like, hey, I'm interested in medical school and I'm pre-med. Can I come watch you? And that was great. It was just kind of clinic visits, and it got me kind of used to the idea of like, seeing patients and just observing and kind of how everything goes. And then the town I was in for college had 2 free clinics. And pre-med students, or a lot of pre-med students, would do things like vital signs. And so I got involved in that, and that was a really good experience. I think those are my 2 main ones. I think I worked in the lab of one of the free clinics too. So I would do kind of lab stuff, but I would still, meet patients and kind of interact with them that way. And then in terms of life, I did take a year off between undergrad and med school. I took the Mcat kind of late and worked in a research lab for a year. And for me, that was great. I think a year off, it's a good thing to do if you feel like it. I don't think you have to. but I certainly wouldn't be against it.
Kind of going off of that, this question was sent in regarding like your clinical experience during your undergrad years and how that kind of influenced what you wanted to do later in your career.
Yeah, it's a good question. I wouldn't worry about it. I think literally any exposure to medicine or veterinary medicine, if that's what you want to do, is good. And I think I didn't know exactly what field I wanted to go into until probably like my second to last year of med school, and tons of people changed their minds. So I know someone who went in wanting to be a pediatrician, and he's a surgeon. And I think there's statistics out there too that something like over 60% of med students end up changing their mind. So I think it's not that important. If you know you want to do a certain subspecialty, like, I don't think it's that important yet to get exposure there. I think just any kind of exposure as a pre-med student is great.
Awesome. And I definitely want to open it up to like anyone to ask any questions that's been on their mind. Does anyone have any that they want to ask?
I have one actually. So I'm thinking of pursuing the MD PhD route. Do you have like any advice? How did you know it was the right path for you?
Yeah, that's a great question. I didn't know about it until fairly late, but I did always have a really strong interest in medicine, just even to college. And then I kind of discovered research during college. And that's kind of when I started thinking about it more. So I think if it's something you're interested in and you already know that, I think getting involved in as much original research as you can is great. If you have the chance to choose between multiple labs, I think it's really important to look at how kind of the undergrads in those labs that maybe have come before you have done in terms of publishing, because you can think of like published papers as kind of like your currency. I wasn't necessarily aware of that as an undergrad, but now that I know better, I would pay really close attention to that. And kind of look at the environment of the labs. Are people happy there? Kind of get a sense or a feel for it.
Kind of going off on that, how are you going to utilize your PhD in your career?
That's a good question. So I think I'm going to do academic medicine. So basically be at an institution that has, a teaching hospital and a medical school. And hopefully, I think the end goal is to have my own lab, but still see patients. So there's different ways of doing it. Some people split their time, 80, 20%. Others have kind of different arrangements. There's lots of residency programs that let you do a couple years of research during your training too. So depending on where you go to residency, that can be emphasized.
Thank you.
Sure.
I have a question because I also am slightly thinking about doing that program with MD and PhD. I think one of the issues that I'm having right is like the competitiveness of getting into that one of those kinds of programs. Can you tell me, like, did you experience that, it being harder to get into?
I don't know if it was necessarily harder. I think that they still put you in the overall pool of the medical school applicants. So they look at you in the context of an MD PhD applicant, but if they decide that they, for whatever reason, don't have a spot for the PhD slot, they'll still consider you as kind of a traditional medical student. And then a couple times what I've seen is a traditional medical student will join the MD PhD program after like the first year or so. Because I think once you're on campus, if you're still excited about research, I'm sure you'll find a lab that'll be excited to take you. So I think, I wouldn't worry about the competitiveness necessarily. I think you still get considered as like a traditional med school applicant too. What are you guys majoring in? I'm just curious. I was a psychology major myself. I'm just wondering what you guys are into.
I'm majoring in biochemistry.
Okay.
I'm also majoring in biochem.
I am majoring in biology and minoring in chemistry.
Okay, so lots of scientists. Okay, that's great.
I haven't decided my major because I'm a first year, but I want to major in physics.
Oh, awesome. That's great.
Science. My major is biology.
Okay. Yeah, I was just gonna say, major in whatever you want to. I have a friend who majored in art history, and she's a doctor. So as long as you take all the pre-med requirements, I think you're good.
I had a question. So for me,
I'm stuck between what to do after undergrad because I do know I want to go to med school, but I don't want to go directly to med school. I do want to take a gap year, but I'm confused on like what I should do for that gap year, and I'm torn between either going for a master's or working for like a year. So what do you suggest?
Yeah.
What do you think?
Yeah, it's a good question. Depends on, I think, a couple of factors. So the one piece of advice I got, because I was also thinking about taking a year off and ended up doing it, was just to make sure that I do something productive so that when, I go to an interview and I'm asked, what did you do with those years? I can say, these are the things I get out of it. For me, that was research. I don't think it has to be research. I think if you're interested in getting a master's, and especially if you feel like you need a little bit more kind of a boost to your academic credentials, then I think that's definitely a good idea. I don't know that you have to. If you're happy with your GPA from undergrad and think that you'll do reasonably okay on the Mcat, or maybe already have taken it, I think you don't have to. If you want to do something like a job, I think that's reasonable too. It's something that like you can kind of think of as an extended like summer internship type of job where there's challenges and things you can talk about in an interview. For some people that's like joining the Peace Corps and going abroad. Other people stay more local, but I think mostly just having something that you'll be able to talk about later. Does that kind of answer it?
Yeah, thank you.
Of course.
I have a question, a very broad question on medical school interviews. So, like you said, people usually don't decide what they really want to do until after like in medical school. So in the medical school interview, what do they ask you for?
They don't ask you really what kind of doctor you want to become. I think they're pretty aware that that's likely going to change. So even if you do have the answer, and lots of people don't, it's probably going to change. They ask you about like your experiences in the medical field. They want to see, have you had any exposure? How do you know that's really what you want to do? If there's any academic difficulties, they might ask, what happened here, or like, do you have an explanation? And then kind of, your goals and motivations, things that are important to you. Maybe activities that you've done during college and how that kind of developed you as a person. I think leadership positions, they especially like to kind of hear about. What else? Some like current events, very, very kind of high level, not very detailed, but like we were told just make sure you know the difference between Medicare and Medicaid, who's covered by what, that sort of thing. I don't think I ever actually got asked about that kind of detail. But I think just, having kind of a general understanding of, what's the Affordable Care Act, that sort of thing. That's kind of most of it I remember.
This question was sent in, but what are some challenges that you faced being a woman in a field that is dominated by men?
That's a good question. There's fewer of us. So in our program, there's 4 of us in a program that has 21 residents. But I think, so one of the challenges is just there's fewer people, but I think it also has its upsides. So the women in the program and I are really close. We're all really good friends. And kind of out of that challenge, I've also, I think, made friendships with some general surgery residents, people who are not necessarily, right next to me all the time in my field, but I've kind of tried to foster relationships and female friendships kind of across the board. I think just like in any situation, just kind of being aware that, at the end of the day, it's kind of the work that you do that you'll be judged by, regardless of others' kind of preconceived notions. I think that's probably the biggest thing there.
I wouldn't let that
deter you.
Oh, sorry.
Oh, sorry. No, I was just gonna I wouldn't let that necessarily deter you, and things are changing too. So just to start off some statistics, I think it's like 15% of neurosurgery residents right now are female, even though the practicing neurosurgeons right now I think are just about like under 6% female. That's changing, and it's changing pretty rapidly. It just is going to take a little while to get there.
Awesome. Did anyone else have any other questions?
I had a question about studying, the amount of studying. Is it true that medical students don't have any time to do anything? And like, how much did you study per day? I know it's like really early for that, but I'm just like...
Yeah, I wouldn't worry about that too much. I mean, it's definitely at the time more information than you've seen. But, you know, people have, you know, some time for some things. So like some people have families and they still manage to see them. And I think, you know, a strong undergrad experience will prepare you. So I wouldn't worry about kind of the amount of studying. It also varied. So like in later years, when you're on the wards, you're not necessarily studying that much. It's just kind of the first 2 years. And I think it's something that you get used to. And I think undergrad, especially kind of like a small liberal arts college, prepares you, generally speaking, I think, pretty well.
Thank you.
Of course.
Kind of going off of that, what do you think the hardest part about your journey through medical school was?
Probably time management. So if that's something that you can get a handle on during undergrad, I think that's a really good thing. I don't think I was perfect at it. I think going back, I would have done things a little bit differently, but I think the important thing is kind of trying to figure out a system for yourself. So whether that's like having a planner or like I don't know, like a digital planner these days, I guess I was going off of like paper and pen, like some sort of system that works for you. I think that you can take with you during vet or med school is going to be really helpful. Because there's always things to do. There's always more studying to do. You got to just kind of manage what you have to do.
Awesome, thank you. And then did anyone else have any other questions?
I had one. So I know traditionally with the MD PhD program, you do your PhD during or in between the didactic and clinical years. Did you feel like you forgot medical knowledge during that time?
That's a really good question. I'm like very impressed by how informed you are about these programs. Way more than I knew at your stage. That is true that most programs have you do the first years of medical school, and then they have you do grad school, and then you return to medicine in the form of kind of your clerkships. I actually did it a little bit differently. So the program I went to at the University of Illinois had you take the first year of med school classes spread out over the course of your PhD, which you did first, and then you did like years 2 through 4 of med school at the end together. So I didn't have this disjointed experience. But I think most schools, when they do kind of break it up between med school and grad school, either offer like a course to reacquaint you with kind of clinical practice right before those clerkships hit, or, you know, prior students have figured out some sort of system, like they'll tell you, you know, make sure you review these books or something like that. So I think you won't be the first person to experience that sort of thing. There's also a really good book out there, and I forget what it's called, but it's specifically about applying to MD PhD programs. If I remember the name, I'll send it to Hannah and she can pass it on. But it's like the one book out on the market, and it's pretty short, but really, really good. That kind of answers questions about the whole process of applying.
Also kind of going off on that, are you allowed to do like away rotations during your PhD in another lab?
I think most graduate programs let you do that, yeah. I can speak to the program I went to. I did 3 rotations, and then I stayed in the 3rd lab I rotated through. I think my guess is most programs let you do that because they want to you know, make sure that you find a lab that's a good home for you, because, you know, then you'll be productive for them and you'll be happy. So I think most places allow you to do that. That said, I think I would identify like 2 or 3 labs at each place that you interview at that you can talk about and talk about why they interest you and kind of why you would want to do a rotation there.
Thank you.
Of course.
And then are there any like opportunities or classes or activities that you kind of wish that you had done before medical school?
That's a good question. Yeah, actually, and it has nothing to do with medicine necessarily. There's like an outdoors adventure, I guess, club at my college. It's just one of those things where, like, you know, like right now I don't have time to go on big camping trips or hikes or hike the Appalachian Trail. But I think that would have been something that, like, had I known at the time, I wouldn't have necessarily time later, I would do. So if there's something that you know, find really exciting and cool, and there's maybe not necessarily a direct reason for why you need to do it, think about maybe undergrad being the time to do it. You know, don't neglect studying, but like just think about kind of a balance.
Any other questions from anyone else?
And the other thing
Oops, sorry.
Oh, go ahead. If you guys have questions, I have one more point, but I'll just, I can get there anytime.
I can ask another one. So kind of like, how is your work-life balance in your current position or specialty?
So it depends on the year. I just finished the junior years of residency, which are pretty intense and probably time-wise the most demanding. So I think my life as of 3 months ago looked a lot different than it does now. And I'm spending this year and next year on research. So that's kind of a different pace. I wouldn't necessarily say relaxed, like I'm writing a grant proposal now. It's pretty stressful, but it's more kind of your own time management again. So I think there's different phases of residency, but again, that whole time management thing that you hopefully perfect in undergrad and then take with you to med school will help you in residency as well. But in terms of like clinical stuff, I only do probably 3 nights out of the month of clinical stuff, and then the rest is just research.
I had a question. So for the Mcat, how, I don't know if you already answered this, how exactly did you study for the Mcat? Because for me, I don't think I plan on taking the Mcat now, but I just wanted like tips on like how I should start doing, like studying now, what topics I should really pay attention to. And especially because, I don't know if you heard, but like Khan Academy is taking down like all of their Mcat videos. So like now that there's kind of less resources, what steps do you think I should take now for the Mcat?
Yeah, I'm not sure if my knowledge is current. I know the test has changed too since I took it. When I took it, it was out of a score of like 45 or something. And I understand it's different now. They've added like psychology or sociology, something else to it that I did not have to do. I ended up taking a course. I don't think you really need that. I think if you just get the review books, you can probably just study it on your own, as long as you have like a dedicated schedule to do that. I ended up mostly just using those books kind of after the course was done during the summer before I started like a lab position, and studied that way. But I would go with kind of, I don't know if there's like online forums these days about recommendations about what books to study, something like that, where, you know, if other people have used them before, they can tell you which ones are good and which ones aren't. And definitely take practice tests. I took a whole bunch of practice tests and I thought that was really useful.
So kind of going back a little bit, I guess, into your past, but like, why did you choose medical school? Like, what made you know that you want to be a doctor?
I always thought it would be really interesting. I'm interested in science, and it's kind of I thought a good way to like directly impact people's lives. And then the direct clinical interactions I saw kind of really confirmed that, you know, like with the pediatrician, I saw that, you know, kids were sick and she knew what to do, and, you know, parents looked to her for advice. And that kind of, I guess, reaffirmed for me that that's what I wanted to do. I think I thought a little bit about becoming like a psychologist at one point too. I think out of the same motivation of like, you know, helping people get through problems. In the end, I think, you know, medical problems are really interesting. So that's kind of how.
Awesome, thank you. And then did anyone have any questions?
Yeah, I have a question. Yeah, so I know you said you took a gap year, and I wasn't really sure if you explained why, but if you did, could you mind telling me again?
Yeah, of course. I actually did it because I was a little bit late in applying, so I didn't plan to take the Mcat like early enough. So I ended up taking the Mcat kind of I think it was June after I graduated. And so I needed that extra year to kind of get applications out, go on interviews. So I guess with more foresight, maybe I wouldn't have done it. In retrospect, I thought for me it worked because it was a really nice time to just kind of, you know, work and get some research done, but also kind of just, you know, I don't know, read books and see friends that I hadn't maybe gotten to see. I moved to New York City. I had a great time there. So, you know, whichever way you decide, I think, know yourself and you'll see if you want to do that or not. The other thing I wanted to just bring up, because I haven't touched on it, was just letter writers. So I think, you know, some of you are still pretty early in your college careers, but I think once you hit maybe your 3rd year of undergrad, start thinking, you know, somewhere in the back of your mind about who some of your letter writers for medical school could be. a lot of the time that ends up being someone you've done research with, or maybe a professor who knows you pretty well. And kind of, if you know somebody might be a letter writer for you, let them get to know you, go to office hours, kind of find ways to allow them to get to know you so that later on they can actually talk in a little bit of depth about who you are.
I know that I'm currently going into like the interview process. So like, how did you prepare for your interviews?
This is med school or vet school? Sorry.
This is for veterinary school.
Okay. I imagine they're pretty similar, but
yeah.
Yeah. I did a little bit of background reading on like things like the Medicare, Medicaid thing, make sure that I like knew answers to that. But mostly I made sure that I kind of reread some abstracts on some papers that I had worked on a couple years before, just because they do like to ask you about research, even if you're not going into a graduate level program, just to make sure that, the research that you were involved in is something that you can talk about intelligently. So definitely reviewed those. And then for the most part, I think there's like prep books out there on like common interview questions. I think I read a couple of those. Things like if you had to say what's your biggest weakness, like what's a good answer and way to frame that. And then just be ready to talk about kind of you. Like I think some interviews, they're literally like, tell me about yourself. Just have like a 5-sentence thing that you can easily refer back to and be like, I come from here and I'm interested in medicine because of, X, Y, Z.
Thank you.
I have a question that's like kind of personal. You don't have to answer this, but like, what kind of like support groups did you have? Like, was your family behind this? Were your friends behind this? Or was this like a little bit harder for you to like kind of push past and get in?
That's a great question. Definitely my friends and family. And I also had a really great group of female friends in grad school who weren't in medicine at all, but they were super supportive and really kind of felt like a chosen family. So for me, the answer to that is friends and family. And for some other people, it can be, religion or other community groups. But yeah, I'm grateful that I had that support.
Okay, I have another question. Sorry.
No, go ahead.
You're into neurosurgery, right?
Yeah.
Okay, because I'm a neuroscience major.
Okay.
Why specifically neuroscience, and then why specifically neurosurgery? And then what about the neuroscience field makes you like excited? Like, what do you like so much about the neuroscience?
Oh, I love talking about all of these things. Okay, here we go. So I was a psychology major, and I think the more classes I took, the more interested in neuroscience specifically I became, and I realized that that's really why I was interested in psychology. So I started doing some neuroscience research in a really great lab in undergrad, and that's how I got into research. And I just think the brain is like the coolest thing there is, and that's kind of still holds true for me. And I figured out in medical school that I really like procedures. I like working with my hands. I like kind of fixing a problem with like a concrete outcome. And so I knew I wanted to do surgery, and then I was thinking about like ENT or neurosurgery, but I was never 100% sure until I kind of looked into the field a little bit more. And now what I'm really excited about is neuromodulation. So things like deep brain stimulation to treat tremor and resections for epilepsy. That's kind of the subspecialty of the field that I'm particularly interested in. So I think there's lots of really, really neat ways to kind of really impact someone's quality of life. And I get really excited about that.
Thank you. That's cool.
If you, this is kind of more of like just like a fun question, but like if you weren't like a doctor, like what other career would you have chosen?
It's a good question. Probably I would be a scientist. And if that also was out of the question, I took some sort of like quiz in college about what careers to pursue. And like pharmacist was on there. I don't know that I would do it, but like maybe. because like there's a lot of like science and mechanism of action, that kind of stuff that goes into that. So I think there's a lot of like healthcare affiliated careers that might fit too. I didn't know what a physician assistant was. I think that's a great career too. You guys actually might be a little bit more informed than I was at your stage, but you know, there's pros and cons to pursuing physician assistant or nurse practitioner school over med school. I wouldn't say one's better than the other, but it's just kind of a neat path that I didn't know existed.
Did anyone else have any other questions?
I have a question. I came late, so I don't know if you guys already talked about this, but I was wondering like what kind of clinical work you did when you were in undergrad, or research. Like, how did that like shape what you wanted to do later?
That's a good question. I think I just touched on it briefly. I shadowed a pediatrician when I was in college. It's just a local pediatrician who practiced in the town where I was living, and just kind of randomly cold emailed her. She was great, and that was a great experience for me because it made me kind of expand my medical exposure beyond like my own personal doctor visits. So that was really neat. And then I got into research during college as well, just kind of grew out of an interest in one of my classes and like approached my professor and started on my own research project. And so I think that experience and then research and then volunteering for 2 free clinics was kind of the medical and science exposure that I got a lot out of too. I know Boston has a ton of medical opportunities. I'm not sure, is it relatively easy for you guys to get plugged into that, or is it kind of a maze of opportunities? Or kind of a mix?
I think it's hard now with COVID because a lot of places don't want student shadowing and vice versa.
Of course. Yeah. How was it before COVID?
Oh, sorry. Yeah, I was just about to say before COVID, sorry. I think it depended on what you were looking for and where you were looking for it. Because I know hospital volunteering, they even go through like a huge extensive process to get to even like volunteer for like Boston Children's. Go up to the hospital front desk and was like, hey, do you have any volunteer like options? So I kind of like, it depends on where you are and what you're looking for. But I think, and this kind of just goes for everyone, like if you are looking for experience, like the best thing to start is Simmons. Because I know, shout out to Sarah P. I love her so much, but she has a lot of things and a lot of connections and opportunities that she can do. We have ties to Simmons that can help us out. And I'm sorry, I'm just like plugging.
No, that's great. Yeah.
Yeah, no, for like the veterinary field, it was like kind of hard for me to like find an opportunity and break into it in Boston. I mean, it was like easier just because Massachusetts is like one of the last states where you don't need to be have a license to be a veterinary technician. So it in that respect, it was easier, but it was difficult. But yeah, it was more just like what Taylor was saying, like going up to like animal hospitals and just being like, hey, can I shadow? Like, do you have any opportunities? And really just like a lot of like cold calls, basically.
Yeah. I had to do the same thing.
Oh, I just want to say, like, I volunteer at Mass General, and I know we're taking new people, so if anyone is interested.
Oh, great.
Yeah. But you have to be 18. I guess everyone here is 18, so it just in case anyone's interested.
Yeah, I guess a lot of this is also word of mouth. Like, you know, you guys happen to know about these opportunities. That's great that you're sharing.
I have a question. So for like when you were in medical school and also I guess now in like residency and everything, like what do you kind of do to de-stress and take your mind off of like when it was school and now like all the time commitments?
That's a good question. I've always run, so I'm a runner, and I do that at least every other day. So that kind of gets me to de-stress. And then lately, I've been getting more into meditation and some yoga. I think it's, you know, it's a personal thing. You know, whatever works for you, whether that's, you know, working out or, you know, meditating, just whatever works for you, I think is the answer.
Thank you. And then could you tell us like a little bit about like your application experience and like,
question. Oh, sorry.
oh, sorry, Taylor.
Sorry.
And then like how many schools that you applied to, and like maybe like why those schools?
Mm-hmm. Sure. For medical school? Yeah. I think I applied to like something like 20 or 30 schools. I don't even know if that's a large number these days. They may not be. But it was mostly kind of either, for me, labs that I was interested in and schools that were affiliated with those, or kind of geographic reasons. So like my parents lived in, or still live in Georgia. So I applied to the Medical College of Georgia, which I think has since changed names. And then kind of just broadly applied. I think I ended up at the University of Illinois because they applied to the Chicago campus, and they sent me a brochure saying like, you know, we noticed you applied, you might want to apply to this other campus as well. And I just kind of like on a whim decided like, sure, I'll send an application in there. And then I ended up finding a lab that I really liked. So I ended up going. So just kind of, I think, be open. You know, probably you'll prefer some sort of geographic location, but if that doesn't work out, it may not be the best place for you anyway. So just, I think, kind of keep an open mind. What's the recommended number of places these days? Is anyone going through the process right now?
I think I've heard for medical school, like most people I know kind of applied to like the upwards of 20.
Okay. Yeah, definitely don't take my number and think that that is like all you have to do. It may have gone up since my time. I kind of came across that a little bit applying to residency, where some people told me to only apply to, you know, a couple of programs, which used to be the norm, but no longer. Oh, I think the internet froze.
Can you hear us?
I can hear you guys now. Okay. Yeah. Am I back? Sorry, I froze. Back. Okay. Okay. How much did you hear? Any of it?
Yeah, I heard it. I don't know about other people.
Oh, okay.
Okay, cool.
Okay, perfect. Yeah, if you guys have upperclassmen that you're friends with, or that like were in some of your classes or something, who are going through the process, those are probably like your best resource. They'll know kind of how many schools is the norm to apply to these days, and like, I don't know, some unexpected new things that they might be throwing your way.
I don't know if you guys already talked about this, but what was your thought about like the financing of med school when you were going into it? I know that's like very expensive.
Yeah, I may not be the best person to talk about this. I guess one of the perks of going to an MD PhD program is that they actually cover your tuition. They give you a stipend just because of the time it takes. But I know someone had looked at like a comparison about like, you know, the number of years that you're not actively practicing versus like the number of years that you're in school if you do an MD PhD program. And I think the bottom line is that like if you enjoy research, then, you know, consider an MD PhD program, but just for the cost, it's probably not worth it to do that. And it's probably worth it just to, you know, take out loans and, you know that one day you'll make that back.
Were there any other questions that people had? What is something that you kind of like most about your job, like right now?
I kind of miss the clinical work while I'm in research now, and I really enjoy just kind of talking to patients. So there is a real opportunity to have like kind of personally meaningful interactions, which is not something that you find in every job. So for me, I think that's kind of really valuable. And I also think it's a job where, or a career where you will keep learning. You know, like there's always new advances, always new research coming out, new things that are getting incorporated into best clinical practice. And so, you know, it's not stagnant, it's always evolving. There are always people around you who are trying to find better ways to solve these problems that people suffer from. So I think, you know, it's an exciting area to really work in. It's never boring.
do you think you want to stay in the Boston area, or do you think you'll end up somewhere else? Or like how long with like the residency, like do you have left in Boston?
I have 4 more years of residency, so I'll definitely be here for 4 years. And then after that, I will probably do like a 1-year fellowship. And that could be kind of anywhere. I'm pretty open. And then we'll see. I'm pretty flexible. We'll see what happens.
So I'm not really sure if, like, I was told that research like takes a little bit more time and is generally slower than like just diagnosing patients and getting them out of the hospital better. Would you say that the pace is different when you're doing clinicals or when you're like helping a patient versus research?
I think it depends on what you're doing. I would say the urgency is different when you're doing clinical work. If someone's outcome depends on you doing something imminently, I think there's much more urgency. But that said, I think you can get, depending on how much research you do, you can get really wrapped up in it and involved. So I think research. I think probably the stress that you experience is a little bit of a function of like how much you take on. Whereas in clinical practice, I think it's a little bit more prescribed. And I think it's a personal preference which you prefer, if you love both and want to combine them. It's definitely like an honor to get to practice clinically. And I think you'll see that too if you shadow, that people really kind of trust you with a lot of things that they don't talk about with anyone else, and kind of let you in on their problems that they maybe have never talked to someone about. So it's a really special thing.
So do you do any teaching at all as like a PhD?
I did. I think the requirement is different across different programs. I did teach or help teach the like medical neuroscience class because that was my interest. And then in residency, like this year, I helped teach parts of the anatomy course for the Harvard medical students. So if you're interested in teaching, I think there's always definitely ways to get involved in that. Medical education is always looking for people who are currently going through training, who are interested in helping. So that's actually probably another good perk of being involved in medicine. Is if you like teaching, there's always ways to get involved. Oh, and I actually think teaching opportunities in undergrad, like if you can be a TA once you're kind of an upperclassman, like a junior or senior, I think those are looked on pretty favorably too by application committees, because it shows that you can master material and you can help your peers. And a lot of medicine is about kind of like the whole see one, do one, teach one, like teaching other people the things that you know. So I'm not sure how Simmons works, but if there's ways to be a TA later, I think that's a great thing to do.
Could you tell us like a little bit about like what your daily like routine is, or like what a day in your life would look like?
Sure. So during residency, junior residency at least, I would get up in the morning and I would be pretty early, like somewhere between 4 and 5. And I would go into the hospital and do what's called pre-rounding. So basically looking at, in the computer, looking at all the like vital signs, lab values, like new scans that the patients that we have on service got done in the last 12 hours that I hopefully was home, and kind of prepare those, go through those, kind of to come up with a possible plan. And then we meet as a group. So different teams of residents meet and we go see those patients. Like unfortunately, we oftentimes wake them up. So it's around 6 o'clock or so. And we just, say hello. For us, we're very interested in the neurological exams. So we want to see, are they oriented? Are they speaking clearly? Are they moving everything symmetrically? Other services are interested in other things, like the GI doctors are more interested in how the bellies feel, things like that. But so we do our rounds, we visit our patients, and then we talk to our attendings. So basically the senior physicians in the hospital who make the decisions, and we kind of present to them the data that we gathered and kind of the exams that we got that morning, and we tell them what we think the plan should be for the patient, and they're there to either approve that or make changes and kind of go over with us why they would prefer something different. And then we go to the operating rooms, usually around like 7:30 or so, 7 or 7:30, and then help with operating. And then afterwards, we do afternoon rounds. So then we see the same patients that we saw in the morning and kind of make sure they're still doing okay, check in with the PAs who are managing the service, and kind of check with our senior residents and make sure there's nothing that needs to, be taken care of. And then sometimes we're on an overnight call, but most of the time, then we would probably go home at some point. And that varies kind of when exactly that happens. That's kind of the typical day, I would say.
Awesome, thank you. And then was there any other questions? What do you think was like one thing that you did in undergrad that like really helped you once you got to medical school?
Let's see, one thing I did. I was a TA, and it was something totally unrelated. It was in German. But I think kind of the experience of like standing in front of a large group of people with like an agenda of what to teach them and like practicing interacting with all of them was something that's come in handy now too. Like there's lots of times where you're asked to give impromptu presentations or like answer questions in front of kind of a group of people. So that's something that I didn't expect. I didn't think that experience in particular would be particularly helpful, but I thought it was.
And then I know like medical school, like they have like their own set of like clubs and everything that you can join. Like, did you get involved in like any of the extracurriculars?
Yeah, I feel like it's almost the opposite question. Like, are there ones that I didn't get involved in? Which is probably actually that's also not what you're supposed to do. I think you're supposed to find like a happy medium. So I worked with a group that had a free clinic. So there was actually a student-run free clinic. And I started out just kind of taking vital signs, and then by the end of med school got a lot more involved, and was helping like write grant proposals, things like that. So that's something I did through all of med school. There was like a health fair that we did once a year for the community. What else? There was like a nutrition group that was bringing talks on nutrition to medical students, which shockingly, I think there's like 2 hours of nutrition education in all of medical school. I think that's slowly changing, but not very quickly. And what else? Yeah, there's tons of groups. For me, I joined the surgery interest group. I joined the neurology group because I at one point thought that neurology was interesting too. I joined a running club. Yeah, I think the key is just to find something that like is sustaining for you, and kind of go with that, because there's gonna always be things that you can also join.
Awesome, thank you. In your undergrad, was there, I know like Orgo is like notorious for being like the hardest class. Like, do you think that was the hardest class? And if not, then like, what did you think your hardest class was, and like, how did you kind of get through it?
Yeah, I think the second Orgo class and physics I found actually very hard. I didn't have much of a physics background from high school, it turns out. And yeah, I think just kind of getting through it, like dedicating, sad Friday nights to studying are kind of just the way to go. And, it ends, and then, you'll be happy that you put in the work. But I think, yeah, just kind of being aware that those are tough classes, like Orgo, and I guess for me, physics too. And kind of making sure that if you have a say, not loading up on all the other difficult classes at the same time. So I think there was one time where I took like an inorganic chemistry class. I think it was inorganic chemistry with like all of the chemistry majors. Like it just was me and a bunch of chemistry majors, and I was lucky because I got to make a schedule that like was pretty light in other regards. So just kind of balancing things was helpful.
Awesome. And then were there any other questions from the group? I know know we're getting to the end, people's minds. Did you have any like lasting thoughts that or points that you still wanted to touch on?
Nothing comes to mind right now. I said my bit about the like letter writers. But if you guys think of other questions later, or if you want to do another session at some point, down the road, feel free to email me. It's M Mustroph, like my last name, at ewh.harvard.edu. And I'm always happy to like shoot you an email back. I'm not sure I'm like the world's expert in applying to medical school, but I certainly know some people who've gone through medical school and can probably, just lend my opinion on things.
Awesome, thank you.
I have a fun question.
Oh, awesome.
I heard that surgeons need to have like really good hands. So did you have to practice your dexterity to become like a surgeon in medical?
That's a good question. Yeah, we do practice tying of knots, like one-handed knots. And then I don't know if I'm doing this enough, but there are certain ways to like hold an instrument. So I've been told to like, when I'm not doing anything else, to just kind of like hold that instrument in my hand. And for us, it's like a hemostat, like a needle driver, where there's a way to like, it's like a clickable thing. It's a clickable instrument. But there's ways where if you don't put your fingers all the way through, you can kind of just have it nestle in your hand. And you can kind of open it and close it very kind of with a lot of dexterity and hand strength. So like we do little things like that where like if we're not doing anything else, we'll kind of sometimes play with like a needle holder or something like that. I wouldn't say we do it all the time, but it's definitely not frowned upon. Yeah.
Kind of going off of that, but like how did you practice like suturing and kind of mastering that skill? Because obviously that's really important.
Yeah. One of the women before me, like when she graduated and went to residency, gave me her suturing like board. There's like, these like plastic board things, I'm sure you guys have too, where you can practice suturing on. And then just YouTube videos, like just YouTube videos on how to like suture. And then if you feel like you're pretty good on that, you can buy like pig's feet at the supermarket for pretty cheap, or oranges even, and kind of suture those together. Banana peels work too. And just kind of rote practice. The great thing is too, if you know anybody who's like a little bit above you and can kind of just watch you and be like, hey, why do you like turn your wrist that much, or why don't you turn your wrist that much? That's really helpful because you might not necessarily kind of see that, or at least like video recording yourself sometimes helps, because you can kind of observe yourself and be like, oh, this doesn't look like the video, like I do this thing that I shouldn't, and then you can like self-correct. So a lot of it is just rote repetition and habit and doing it right.
Thank you. Was there like any like hands-on skill that like you found like really difficult to become really good at?
Sure, there's plenty. But I think during junior residency, I think, like there's bedside procedures that we do all the time. So we do lumbar punctures and like external ventricular drains. And I think just at first having someone guide you through those, and then gradually kind of doing them independently with enough repetitions, you kind of get there. But yeah, there are definitely procedures that I had no idea how to do going in, but you learn how to do them.
Thank you. And then were there any lasting questions? Okay. Yeah, I don't know if you thought of anything lasting points that you wanted to add, but besides that, I think we're getting to time, and I think everyone's out of questions.
Okay. No, you asked some really good questions. Thank you so much for having me.
Yeah, thank you for coming.
Of course. Yeah, if you have any other questions, feel free to email me.
Yeah, thank you so much.
You're welcome.
Thank
Okay,
you.
nice to see you.
Thank you.
Great. Bye. Stay safe.
Bye.